keynote speaker. This time, let me introduce her. She is the Secretary General and the PRO for Local and International Relations from the Philippine Association of Radiologic Technologists Incorporated, a Secretary General of the Philippine Association of Deans and Faculty of Colleges of Radiologic of Radiologic, sorry, of Radiologic Technology Incorporated, PRC member, CPD Council of Radiologic Technology, World Radiography Educational Trust Foundation Ambassador to the Philippines, ISRRT Council member of the Philippines, International Council member of the for Philippines to International Society of Radiographers and Radiologic Technologists. Let us please welcome Miss Peachy Luna.
Right. Good day to you, and thank you for your introduction, Mr. John Harabata Vengado. I am pleased to be invited by Dr. Carl Balita, who's well known in providing useful services not only to professionals but to the many listeners and followers of his Radio Negosyo program. And greetings to all the X-ray and radiologic technologists, to all our beloved students in the Philippines and the world. COVID-19 is a threat to the global community, challenging governments, health systems, and institutions to effectively respond to it. And to respond to COVID-19 pandemic, radiographers or X-ray technologists, as we call them, and the radiologic technologists need to be supplied with the best information available to understand the potential risks of these virus to patient and practitioners, and to optimize imaging quality as a tool to facilitate more accurate diagnosis, management, and follow-up of suspected and confirmed cases of COVID-19. During the early onset of the pandemic in the country, the WHO expressed concern over the high COVID incidence among the country's medical frontliners. According to WHO Western Pacific Region COVID-19 Incident Manager Dr. Mohammed, the alarming development may be due to the lack of personal protective gears, its improper use, or the increasing number of cases overwhelming the healthcare system. Last month, we have over 2,600 infected healthcare workers who have contracted COVID-19. The radiologic technologists consistently ranked fifth among the 5 medical professions with the highest number of cases since the start of the pandemic in the country. Although there is increasing number of health workers who have recovered, X-ray techs and radiologic technologists need to stay vigilant in protecting themselves against contracting the disease. Currently, we have a total of 22,570 radiologic technologists and 9,502 registered X-ray technologists in the Philippines. But a growing concern is now getting the attention of the Board of Radiologic Technology, Philippine Association of Radiologic Technologists, and Philippine Association of Deans and Faculty of Colleges of Radiologic Technology. This is the less number of expected graduates in years 2020 to 2022. As a matter of fact, decrease in enrollment was already affected by the K-12 system that was implemented about What is the implication of this? That less number of future radiologic technology professionals are expected. But we are sure that aside from the current high demand for X-ray technologists and radiologic technologists, the pandemic has increased the demand for more It is of paramount national interest to ensure that the country shall continue to have sustained supply and prepare sufficient health personnel like the RADTECH to meet any further contingencies, especially to replace, substitute, or reinforce existing workforce who are currently in the peak months after the emergence of the pandemic in the country. The Philippine government has suspended temporarily the overseas deployment of healthcare workers, including radiologic technologists, to ensure that the country has a sufficient number of health workers amid the public health for COVID-19 response, and included hiring radiologic technologists on a contract of service basis for a minimum of 3 months, as it helps to augment our current health workforce who are working tirelessly in our fight against this pandemic. We hope that more graduates consider passing the PRC licensure exams for RADTECH and X-RAYTECH this December 10 and 11, 2020, and be able to serve especially at this high time of the pandemic. To work as a frontliner during this time of crisis is a heroic experience. When you risk your lives for the purpose of serving others, for the goal of helping our patients recover health and survive illness, you can imagine how RADTECs have experienced less priority being given as they were considered as less vulnerable to exposure to COVID-19 with regards to supply of PPE and being waitlisted for COVID-19 swab tests. There is also social discrimination when the RADTECs and X-RAYTECs weren't easily recognized as frontliners working in a hospital. They were even asked of what roles the RADTECs are doing as frontliners. And good thing, many people now know more about the word X-rays. In giving recognition of the critical roles and essential services of the X-ray and radiologic technologists as frontliners, we in the Continuing Professional Development Council for Radiologic Technology and all other councils, through the issued Resolution number 1239, series of 2020 by the Philippine Professional Regulatory Commission, PRC, grant the 25 to 45 CPD self-directed learning credit units to all the RADTECH and X-ray tech professionals who worked during the pandemic. Now, another important concern is that we all know that there is increasing number of infected patients coming to our health facilities now. There is also increase in the use of radiation devices to augment efforts to treat patients, such as during patient assessment, monitoring, and guidance to clinical treatments. We should utilize our medical imaging devices to supplement the management of confirmed cases with infection control protocols set up following the recommendations of the Department of Health, and adopt a more in-depth guidance on how medical imaging technologies can be used to support diagnosis, on safety procedures, the consensus of recommendations at national and international levels. Local and international groups concerned with radiology and radiologic technology have pointed out that radiation devices should be used with caution and for justified clinical indications only. The Philippine College of Radiology and associate societies such as CTMRI, Society of the Philippines, the Ultrasound Society of the Philippines, through the issuance of separate guidelines and recommendations. We should remember that in our use of our MRIs, point care ultrasound machines, and others, no practice involving exposure to harmful radiation should be adopted without prior justification. There are many well-documented evidences suggesting that chest X-ray should be the first-line imaging tool to support a diagnosis of COVID-19 in patients. There is also strong suggestion that the more complex CT scan, computed tomography imaging of the chest should be reserved only for critically ill patients with an unexplained deterioration in their condition. Finally, in keeping positivity amidst crisis during the pandemic such as the COVID-19, we should keep excited of working together to produce something our radiologic technology community and colleagues can use to update themselves on current guidance of imaging techniques and safety regulations applied for COVID-19. It is clear radiologic technology practice will have to adapt for some time while providing high-quality services to all patients, and particularly to COVID-19 patients in this critical time. But We should always seize opportunities arising in the middle of a crisis. It is our aim in the World Radiography Education Trust Fund to help educate and impact the high roles of radiographers, X-ray technologists, and radiologic technologists, and hopefully gain more recognition of the critical contribution radiographers and radiologic technologists make to global health. We are grateful to our leaders in the ISRRT, International Society of Radiographers and Radiologic Technologists, WRETF, World Radiography Education Trust Fund, PART, Philippine Association of Radiologic Technologists, and associate groups for the untiring devotion and commitment to represent, work, serve, position, lead, and continuously uplift to elevate the profession to the highest practice standards. I thank you all healthcare workers and radiographers, all the radiologic technologists and X-ray technologists who have been bravely and selflessly working on the front lines in this fight against COVID-19. You continue to inspire us all and make us hope for a radiant, beaming, and safer future. Thank you, everyone. Thank you, Dr. Carl Balita Review Center for this great opportunity. Maraming salamat po.
Ayun. Very well said, Ma'am Peachy. Actually, Ma'am Peachy is, ano po, no? Siya po ay present po sa digital world ng RADTECH. Makikita natin siya sa different international webinars that are conducted by ISRRT, by the PART, and the WRETF po. So we thank you for your quick response in accepting our invitation, and sa mga manonood po natin, aspiring RADTECs, officially, Ma'am Peachy would be part of our faculty for our RADTECH review program. So maraming salamat po, Ma'am Peachy, in behalf of CBRC. And ngayon po, kasama na po natin si Dr. Carl E. Balita to welcome us and to share the overall inspiration of coming up with this event. Here's the proponent of the Omni Model Learning Experience Model, the training director, the president and CEO of Dr. Carl E. Balita Review Center, the innovative and visionary leader, entrepreneur, and educator. Let us all please welcome Dr. Carl E. Balita.
Hi, magandang hapon sa inyong lahat. Good afternoon, Ms. Peachy. I was listening to you. You're such a beautiful face and a brilliant mind to be leading health professionals in these very trying times. You know, I love the theme. It's radiating positivity. Positivity is what we need, but we want to be negative. That's how it works. But let me, as a health professional